Ladies and gentlemen, so I'm Haja Bahir. I'm a breast cancer specialist by background, and today I'd like to talk to you about women's health and more specifically the challenges that we on a community level face when it comes to health. I think we can all agree that irrespective of gender and sex, global healthcare challenges such as poor accessibility to good quality healthcare, socioeconomic factors, and also cultural factors can all contribute to people not getting access to the healthcare that they deserve and that they need. But when we look at women in particular, there are a lot of challenges, as I mentioned, on a community level that we face. Firstly, and I think a lot of these challenges stem from this one problem that we have, is the historical gaps in female-focused research. So sadly, women are underrepresented in clinical trials. And what that means is a lot of the drugs that we are taking to prevent disease, cure disease, treat disease, have not actually been studied on us. They've been predominantly studied in men. So yesterday I had the pleasure of leading a discussion on non-communicable diseases and the increase of the burden of them in females in particular. And when you look at those diseases such as cardiovascular disease, diabetes, cancer, we are treating women for these diseases, but with very little understanding as to how this disease presents in men and in women, and therefore the right interventions and the right treatments that we prescribe for them. As an example, if we take something like a heart attack, so in 2022 there was a piece of research that was done. The outcome of the research and the conclusion was that 50% of women are more than likely to be misdiagnosed after a heart attack. And the reasons for that are that the symptoms that present in women are different to those that present in men. So what we know from a heart attack, and I think everybody can agree here, that chest pain is quite often associated with a heart attack. But in women in particular, things like fatigue and shortness of breath are actually more prevalent in those, and they often go unnoticed. So the American Heart Association did a study looking at this in this region in particular, and what they found was that women were quite often getting delays in the treatment and their diagnosis of a heart attack for those reasons, because the symptoms that they were getting were not associated with a heart attack. So that's just one example of a specific condition where we have not studied it enough in women, and therefore delays in treatment and ultimately disease outcomes have a big effect on them. So we've covered misdiagnosis and the lack of female-focused research. The next one that I'd like to shed a bit of light on, and that is region-specific, but also is applicable to other population groups around the world, is the cultural beliefs aspect. So we know that there are a lot of cultural stigmas around specific conditions in women that prevent them from seeking the right medical attention that they need. So in line with my expertise, so if we take breast cancer for example, so breast cancer is the most common form of cancer in women in this part of the world, and it actually comes up to about 38% of all cancers in women in this part of the world are breast cancers. Now sadly, even when these females present to the doctor with the symptoms of breast cancer and they get a diagnosis, it's quite often at the late stage. And that is because, as I mentioned, they were reluctant to seek that medical attention that they needed. And unfortunately, the collateral damage of that is that the disease outcome and prognosis for these patients isn't what it should be. So when we look at all of those things as the challenges, those are the ones that, when I was asked to speak about this and I thought about what are the key things that we struggle with as women when it comes to these challenges, those are the ones that stood out to me. So if we were to think about those are the problems, so what are the potential solutions that we could have? I think first at the top of my list would be having more women included in clinical trials to get an actual understanding of how these diseases present in men and women, and therefore the interventions and the treatments that we do need to be focused on women, and that's in the preventative setting, and that's also in the setting where people are being diagnosed. Secondly, I think and I know that from the panel discussions yesterday, there's a lot of work that goes on when it comes to community engagement. But this raising awareness for women that don't have access to healthcare, don't have access to the media and social media that we have, we need to work on that. And I was very happy to see even today that there's these leaflets floating around teaching women how to self-examine themselves for their breasts. And then lastly, no, I think I've covered it. I think those are some of the solutions that we could do for the problems that we have. There's lots of work to do, but there is a lot of work that is being done at the same time. So thank you for your time.